along the medial border of the scapula, and I lift up, and then I move superiorly so that I am right on top of over there. Attachment there. And I'm going to hold that. I can also get down, if I reach far enough, I can get down into the rhomboids a bit. And I'm using my elbows as leverage. So I'm pressing my elbows into the table so that I can lift with my fingers. And so it's not just my hand strength that's doing it, because that would be super exhausting. So once I've warmed up levator a bit, you can come in with some circles if you want to. If I feel like I really need to get in deeply, I can curl my fingers and get in here. All right, then I can transition up actually into the neck. And here I am using my thumbs on either side here. And I'm going to just press inward, like medially, with my thumbs while I'm supporting with my fingers. If that makes sense. I don't know if you can do that. Again, I am anchoring with my elbows. If I don't have my elbows on the table with my client, then I'm anchoring with my forearm. But I'm basically hinging like a lever. So we're just gonna basically move. I usually start at the top and move down, pressing inward. You can also press inward with your fingers, although this one I think is a little bit harder on your hands to do. And then I can grab right in here, right along each side of the spine. You can also just lift up with your fingertips. And let's pull superiorly. We're going to come back to this area, but I like to work on an area and then transition to another area and then come back. So now I'm going to start warming up the traps. And I can basically do a pincer grasp, but I am resting the traps like on my forefingers like this. And then with my thumbs at the top, I'm doing a pincer grasp. So my thumbs are doing the work, but my fingers are the surface that I'm pressing toward. And I usually start kind of in the middle of the traps because that's usually where a lot of the tension is. But I make sure that I take it all the way up the neck. And I'm still doing a little pincer grasp. Just now it's just small little pinches here, right there. Taking it up the neck. All the way out to the attachment. All the way to the All right, so this might be the part, Zephyr, where we have to hand the camera.
Pause it a second, Phil.
Work. Now we're going to work in the scalenes. And I know this is kind of an intimidating area because it feels super vulnerable. And you know that there's important blood vessels in the brachial plexus and stuff here. So our border is going to be the SCM, which is right here. We're not going to go more anterior to that because this is the throat and we don't have any business to do up there. So we are going to be using the SCM as kind of our border and working the scalenes all along this area and then up the neck.
So from medial to lateral.
Yes. And you can press in here a lot more deeply than you might think. Because I'm using significant pressure getting in here. Yeah.
What's in my mind right now is where's the jugular? Isn't that the danger zone?
So if you happen to feel, usually it's going to be the carotid artery that you feel. So if you're in this area and you feel pulsing under your fingers,
Move away.
or, yeah, just move slightly, and it's real slight. I mean, the carotid artery is not that big, so you can just, move a couple millimeters,
Okay.
and it'll be okay. If they start getting like tingling and numbness in their hands, same thing, just move slightly. But lots of times the scalenes are so tight that you're not gonna get to those structures right off the bat.
Okay.
And so I like to warm them up, get in here, and I try as much as possible to support my thumb and not like hyperextend here. So I'm using Jill's body to help hold my thumb in a good position so that I'm not using too much of my thumb. And I work one side at a time. So I'll warm this area up and then move to the other side. And while I'm working on the other side, I just have a nice like resting handhold, kind of saving my place so that when I'm done with the other side, I can just transition back over. So now when I'm getting in here, I'm doing one side, pause, other side, pause. That way, it kind of feels like I'm doing both sides at the same time, but I'm really only pressing on one side at a time. All right, so when we're going to take this up into the neck, you can follow the scalenes all the way up here. And what I usually like to do is start superiorly and then do some more like lateral friction or linear friction, excuse me, all the way down. And when I find little stuck spots, I can pause. You can see the SCM is right above me.
You see the pulse.
And then when you start getting more inferior, because that it's gonna kind of widen here, then you can transition into using more of your thumb. I'll also, while I'm up here, I'll show the other part of the like little pincer grasp that I was doing. So I start toward the occiput and just do little pincer grasp. And then here I am at the traps. I can follow these down. And in some of the places, like especially in the traps, sometimes I'll roll the tissue a little bit between my thumb and my supporting fingers underneath. So I'm supporting the traps and then just kind of rolling the tissue. We can get into the SCM. I'm gonna start, well, depending on the person, I will usually grasp toward the middle just so that I can find the easiest spot of the SCM to grab. And I will place my finger under the SCM and then just like what I did with the traps. So I have a bunch of fingers supporting under the SCM, and then I just use my thumb to squeeze. And it might roll a bit. If it rolls, just start over. And I work all the way down. Now, remember, it's gonna split into two little heads down here. I can grab them both at the same time with a wider grasp. All right. So we have both of the heads of the SCM, and on Jill, it's really easy to find, and I can put my thumb kind of in between the heads here. So I can grab them both at the same time and give them a squeeze, or I can do each side kind of individually, but that feels kind of pinchy to me. So I like to just grasp at the same time. And then kind of rolling a little bit, just checking all the tissue there. And then go back up. All the way up to the master. All right. So once I find myself up here, this is where I can start doing some work toward the occiput. But I usually start right here, right at the mastoid process. So I'm like right behind the ear. And there's a nice little finger hold here. So I can just dig in, and I'm just pulling slightly toward my body. So this isn't really traction, although I do traction from the mastoid process, but when I do it, I am kind of locking the heel of my hand there and then tractioning. So up here, we're just using that little pole for leverage. And you can see that like when I'm down here where the like little fine hairs are, oftentimes I will like pick my fingers up and move them instead of just trying to slide, because that's how you start pulling people's hair or tangling their hair. And I'm getting even a little bit under the jaw here. All right, do we want to transition under the table again so I can show the occipital stuff? Sure. All right, so we've released all around the mastoid process, and now we're moving back toward the occipitals and the suboccipitals right back here. So when I work these, I'm going to just tilt their head, and I'm cradling it in one hand while I slide my hand under, and then I tilt just slightly and slide my hand under again. So I've got all of my fingers lined up at the occiput right here. I can relax my hands, and Jill's head is cradled in my palms. And here, I can just do like little warming. It's kind of like a kneading, but with your fingertips. I can move a little bit outward and then back in. Then we can So now I'm ankling my hand slightly so that I'm lifting Bill's head a little bit so I can really sink into this tissue back here. There's quite a lot of tissue and it's almost always all stressed out. So we're just going to sink in here. If you want to know if you have reached the depth of the suboccipitals, you can ask your client to move their eyes from side to side, and you can feel like a little fluttering movement.
What?
Mm-hmm. Okay. So for, like headache treatment, that's an important marker to know what depth you're at. But for a relaxation massage, I'm usually, I'll get pretty deep here, but I'm not specifically looking for the suboccipitals, if that makes sense. All right, now I've released Jill's head. And I can also come in here with a thumb and work along this line. So I will start laterally and just glide as much as I can. Glide my thumb medially, just along this ridge here. So I start, it's really hard to demonstrate this one.
Are you using the side of your thumb? I can't tell.
Yes, I'm using the side of my thumb.
Okay.
And I just want to come back and make sure that the areas that I've worked on previously haven't started to get cold and tighten up again. So here I'm doing a lot with my fingers, but then also I'm using this same motion here to work on the scalenes at the same time. Just that same movement that I was doing with the C-shaped hand. But now instead of concentrating mostly on the front, I'm doing both at the same time. Just as a warming, relaxing. If I feel like there's still tension in levator, I can come back here and do another upward press. You can come up here and just give the traps a little squeeze and follow it all the way up. All right, and I usually right toward the end of my massage is when I do the traction, just because they're nice and soft and loose at that point, and I'm not gonna, if their muscles are cold, there's a potential that you could actually hurt them and not give them that nice lengthening stretch that you want to. Although I find that the traction often loosens things up, and I wish I could do it at the beginning and just make my job a little bit easier. But it doesn't work like that. So if I've missed anything, the traction will often like loosen it up for me. And you can do it in one of two ways. I've started doing it so that I have my hands locked in here at the mastoid process. And I'm gonna cradle the head like this and using like my wrist and heel of the hand pull toward me. And I like this position because I feel like I have a lot of control. I can do it for longer because I'm engaging bigger muscles. I'm using my legs here. But you can also do traction directly from the occiput. So you line up here. And it's a little bit hard with this particular table, but then you just pull toward yourself. And I'm kind of anchoring my forearms down so that I can pull. You want to make sure that you are resting their head nicely on your hands, because when you do movements like this, people, if you don't have like a nice firm place for their head to rest, like if I were going to try to do this without cupping Jill's head, her head might start to wobble a little bit, and that feels really really insecure. Like you don't have, like they can't be confident that you've got their head. So you want to make sure that you always have like a nice firm cup around their head so that they're not going to wobble back and forth. Especially when you're doing like the mastoid pull here, I will use my thumbs around the top. I will just, like have my little C-shaped hands. And I'll rest them kind of underneath the SCM so that my thumbs have a place to go, but also so that it just really makes this feel secure, like almost like a neck brace. And then once you've done the traction, you can just get in there with some really nice effleurage. We're just kind of saying goodbye. And then my final movement will usually be either resting my hands under their head like this and just taking, a few breaths, like a static hold. And I'll either do it on the head here or I'll do it on the shoulders. Okay, thank you, Jill.
Thank you.